We shall now go on to our next speaker, Dr. SHARAD PATIL. I think the expert panel are not going to find it easy anymore. We are going to be back to you. He is the medical director from Sushil Eye Hospital, Nasik, and he is going to show us an interesting video. On to you, Dr. SHARAD.
Hard cataracts is always a problem to beginners or even people who are experienced. And if your phaco machine is not a very advanced machine, that can create a lot of issues. So I'm working in a small town where I had these problems. So long time back, I shifted to Akahoshi pre-chopper, and Akahoshi pre-chopper had. So this is, you can see, this is a brown to black, very hard cataract. And even Akahoshi pre-chopper could not enter inside this nucleus. So since last couple of years, I'm using single blade of Akahoshi pre-chopper. That is called a single blade pre-chopper. And you can see it's a quite thin with sharp tip. I have supported nucleus at the equator by nucleus sustainer, and it easily breaks down. Sort of a horizontal chop. You have to just tilt nucleus either in the bag or slightly up, and you can see if you enter in the mid periphery, you can easily break down this even very hard cataract. And this is very helpful to me to save phaco energy, time, as well as heartbeats. So most of my cases, all of my cases, I use a single pre-chop for very hard cataracts and regular Akahoshi pre-chopper for soft to moderate cataracts. This is a Akahoshi pre-chopper, but it's not original Akahoshi pre-chopper. It's made locally, and you can see you can easily break this nucleus. This is a moderate type of a cataract, and you can easily crack it open. Once you make 2 pieces, rotate it, and make 4 pieces. You just need some hold by the tip of this pre-chopper. Again, this is one more case of single blade pre-chopper. This is recently made. It has got some curve, and you can see even very hard cataracts. The biggest advantage with hard cataracts that epinucleus is also very dense, as well as nucleus is also dense. So in one go, you can entirely crack this nucleus, and it doesn't take more than a couple of seconds or minute or so, but saves a lot of headache, where either you can't break the posterior plate or you end up using a lot of energy to break down these cataracts. So it almost saves 70 to 80% of my phaco energy. I've got a couple of recordings. This is again a single head pre-chop. I use this pre-chop in all my phaco patients, whether it's a soft, moderate, or hard, or even in SICS. It's basically a horizontal chop wherein you support equator of the nucleus with sustainer, and you bury the tip of pre-chopper to the mid level of nucleus and just do horizontal separation of. This is a single head pre-chopper. You can see it's very thin, tip is a bit sharp. This is a sustainer with the ball point on the tip, so it has never damaged capsule. And this is a regular pre-chopper, Akahoshi pre-chopper, which can be used in soft and moderate type of cataracts. I will show you how can it be used. How can it be used in SICS? This is very hard cataract. almost grade 5 to grade 6. Even if you can break one edge, you may not be able to entirely divide it into two pieces, but you keep on separating these pieces. Let's use single pitch. Yeah, this is a AIOS pre-chopper, and you can see it has got very dense leathery fibers, but still you can divide it into two pieces. You deliver that lens, if possible, in the antechamber. You can do this pre-chop in antechamber also. And with serrated forceps, one can easily take out two halves of the nucleus to the really small incision, scleral incision.
That was a nice series of videos, Dr. Sharad, which you showed us. But to just, I'm sure each one would know how to do the procedure in a particular way. But there is definitely, it was an interesting tip which he showed. But if it is a case of a hypermature cataract where there is no epinucleus cushion, I wanted the expert panel's opinion, Dr. Ajay, maybe. Would you think that there is the protection of the epinucleus would be missing in those cases? Would it be a little challenge in those cases?
Absolutely, it's a bit challenging because it just depends on how much viscoelastic, especially in hypermetropes and in the nucleus, which is, I think he must be an expert, he must be selecting his cases with him, but these black cataracts definitely, have the snares of the Zysep got out the snare where you make it into 4 pieces and all. So it definitely helps if you can do it some sort of mechanical separation. Femtolaser also does that special to reduce the energy. But yeah, definitely there are some cases which are really challenging, especially in a small, the AC is less.
Dr. Sharad, would you think there is any particular contraindication when you would not use a pre-chopper like you have shown?
Mostly, if there is a zonules are weak,
yes,
that is one thing. And if it is very hypermature liquefied cataract, then that may be a capsular bag is very floppy.
Yes, and you need to.
Chitra, can I ask a question?
Yes.
Very interesting videos, Dr. Sharad. Really innovative technique. Just a few questions. One was partly answered in the sense that, unlike in a snare where it is from the periphery to the center, here the force is from the center to the periphery. So
no. This is with the help of two instruments, nucleus sustainer and pre-chopper. So it enters in the mid-periphery, and both the instruments, they are brought near each other. Means your direction of force of pre-chopper is always towards the tip of the sustainer. And once you come closer, you can just separate these two instruments and it cracks open.
The conventional Akahoshi chopper, of course, you used a single feed also.
Conventional Akahoshi chopper goes from the center of the nucleus and it opens up, it goes from inside out.
Yeah, so, I mean, especially in these really hard cataracts where the zonules are also suspect, maybe it might be a little dicey to use it, but you did mention that zonules are weak, you may be a little wary of using it. You said that you use it in all types of cataract, whether really soft cataracts, will you get a hold or just cheese wires?
Soft cataracts, it easily buries inside to the mid-level of the nucleus and it can be easily separated. It doesn't cause any stress over the zonules. And if at all you fear that it's causing some stress on the zonule, you can always support equator of the nucleus with a sustainer. But most of the soft cataracts can be easily divided into 2 or 4 pieces with Akahoshi pre-chopper. And single-head pre-chopper I mostly use only for hard cataracts where two blades of Akaushi pre-chopper cannot go inside, but single blade of the Akaushi pre-chopper, it can easily penetrate nucleus and it can be easily separated horizontally by horizontal chopping.
Dr. Mohan had something to ask and Anaga had something to ask. Yes.
Chitra,
So first, yeah.
Yeah.
Chitra, are you able to hear me?
Yes.
Yes, yes.
No, Sharad, because I was there only at the end, the last video I saw, you brought the nucleus up into the anterior chamber with the pre-chop.
Yes.
Yeah, that was a SICS case.
Why did you
Yeah, that
not
was
do it in the bag?
No, I started doing it in the bag, but if you fear that it's causing some stress and nucleus is very hard, you can deliver it in the anterior chamber and can complete that division. Because that was case of SICS, it was possible for me to bring it to the anterior chamber and divide the remaining part of that posterior plate by Akaushi pre-chopper in the anterior chamber.
Do you need to make your rexus a little large to do this
bigger.
procedure?
Yeah, actually.
Yeah, it's definitely makes easy if you make it little larger.
Ma'am, can I ask something?
Yes, Anaga. Yes,
Yeah,
Anaga.
excellent videos, Dr. Sharad sir. Actually, I also had the similar question. Like one thing is you might need a larger CCC because you need to tip one edge of the nucleus little above so that it's easier for you to do the procedure.
Yeah.
In cases where you have corneal gattata or if there's an anterior
Video not clear.
tear,
Audio not clear.
Yeah, it's clear for us, Meenakshi.
can you hear me? Yeah.
Yeah, you can
Yeah,
use
so if there's an anterior capsular tear, for example, or if there's corneal gattata, then, and if you have a smaller rexus, for example, then it could become a little difficult. So what do you
Sure.
think is the damage to the corneal endothelium in all your cases?
No, in fact, it doesn't touch corneal endothelium all the time. One edge may touch at times, but it doesn't entirely come into the chamber. Most of the lens is still inside the bag. Only one equator of the lens that is tilted upwards.
Dr. Arun?
Yeah, the main challenge, what I feel in hard nucleus is separating the posterior plate, which is thick, cheesy fibers, and you really need to separate them. You need to. So, how successful is this chopper in separating that posterior plate? Where there are cheesy fibers, the posterior plate is leathery. So, how successful are you in separating that posterior plate?
Almost all cases, I'm able to separate this posterior plate as well.
Oh, very good. That was a wonderful surgical display of your amazing chopper technique, and we definitely would like to go back and try.